President Trump giving lawmakers an ultimatum this morning. Vote on the health care plan today or leave the Affordable Care Act as it is.
The vote is scheduled for this afternoon, but the House decided to delay it yesterday because they didn't have enough votes to pass it. President says he is done negotiating. This is it. The Trump administration's tough language, though, still not enough to convince some Republicans.
And I have to keep in mind what's best for the people that I represent.
Are you still a no, Mr. Donovan?
There is debate among lawmakers about items in the bill. Some want to take away the rule that keeps coverage for pre-existing conditions. The other sticking point is keeping people under the age of 26 with their parents' plan. Some GOP lawmakers also want to cut back on essential health benefits that are currently covered. That includes maternity leave, mental health care, and ER visits. Now, lawmakers have been busy making changes to this bill to see what will pass. The Congressional Budget Office says the latest version would leave 14 million additional uninsured people next year and another 24 million people more than a decade from now. Average premiums also going to rise over the next 2 years compared to the current one, but the report says those premiums would eventually fall. Here in Texas, no doubt several healthcare groups are closely watching what is happening in Washington, D.C., or what doesn't happen. They're heading to the state capitol today with a message for state lawmakers.
That's because two options in the American Health Care Act could drastically change how the state's Medicaid system is paid, affecting millions of patients. KXAN's Gigi Barnett is live at the Capitol this morning with a deeper look at the issue. Good morning, Gigi.
Good morning. That group of healthcare workers who will go to the Capitol today say they are focused on Medicaid because it serves the state's poorest patients. That's more than 4 million people. Now, under Medicaid, it is paid for by the state and the federal government, a joint venture. But healthcare workers say they fear that under President Trump's plan, it's going to cut millions of dollars out of Texas's Medicaid program. Here's a look at the two ways to pay for Medicaid that Congress is currently considering. First, block grants. They allow the federal government to give states one lump sum of money and turns control over of the Medicaid system to the states. The second option is a per capita cap. That means the government would give states money. It's based on how many patients are enrolled in the program and then set a cap on how much each state can spend. Well, there are pros and cons for each, which would affect low-income children, disabled, and pregnant women. Healthcare workers say both choices would hit Texas hard because the state is already paying lower than the national average for Medicaid patients, and it has the most uninsured people than any other state. Plus, Texans may not have access to new life-changing drugs because they'll cost much more than the state will be able to pay under the American Health Care Act. But other groups say there's an upside to all of this, and that is that states will have more control over how to run Medicaid and how they can better decide changes that would save money or either make cash for Medicaid. That brings us to today. The Texas Alliance for Healthcare, it's a group made up of healthcare organizations, says one reason they're reaching out to lawmakers is because nearly 75% of Medicaid patients are poor children.
We want to make sure that low-income children continue to get what they need in terms of health coverage so they can go to school and learn and grow up to be productive, and they often need health care to do that.
This latest version of the American Health Care Act that Congress is considering potentially today would also give tax breaks and more benefits for older patients and some disabled Medicare patients. Back to you.